It's Peter from the Pain Toolkit, and with a colleague of mine today, Grania Daniels. Hi to you, Grania. How are you today?
I'm good, thank you. Yeah. So thank you for inviting me to talk about this. I am a physiotherapist, but I've got 20 odd years experience of working in chronic pain, and I've worked for a long time now as a non-medical prescriber. So I talk to people an awful lot about the limitations and challenges of medication in chronic pain, and it's a really important topic that doesn't get enough discussion.
Now, we're at that point in the booklet, really, in this special edition of the Pain Toolkit for people who want to come off pain medication, etc., and what they call tapering, and I'm guessing that's the word I'm using, like, because it's one I'm sort of familiar with, who'd like to come off their pain medication, to replace it, but to learn some self-management skills, which we've highlighted in the booklet. So, first, can I ask you first? I know for me, reading information on social media and also at pain conferences, that um, uh, pain medication can be a problem for people with long-term pain, and respect that the side effects from it, be like fog brain, um, uh, constipation, and stuff like that. Are there any others that you can think of?
Yeah. Now the main side effects that we notice that well, there's two categories. There's the ones that affect your quality of life, and then there's the ones that are actually quite risky for your general health. So one of the reasons why opioids are so much in the news is because they can have significant interactions with other medications and can repress your respiratory system, your breathing system, and that can cause some quite significant side effects of daytime drowsiness and problems with breathing at night. So that might be one of the reasons why your healthcare professional might be wanting to look at your medication. But there are another group that are really more around your general quality of life and general well-being. Weight gain is probably the single biggest side effect that I have people come to me, not almost realizing it's a side effect of medication. They'll come to me and they'll talk about how they recognize that they've put on lots of weight and they're really worried about it, and that's not helping them with their pain. And they won't have necessarily even been made aware that that might be a side effect of medication. And it's a big side effect of one particular group that patients are often on, which is gabapentin and pregabalin. And the other one in is this sort of brain fog. People think sometimes that it's because of their pain or their pain condition. Often with fibromyalgia, people do talk about brain fog, and it can be. But equally, it can also be a really significant side effect of opioids and these other medications as well, that you just get forgetful. People think that they're losing their memory. They think that they're losing, their ability to concentrate. They struggle to read sentences, and that all affects your quality of life and your ability to be present and everything else. So that can be quite a significant reason for wanting to think about reducing medication.
It's funny as you read, saying about all the side effects. I'm sitting here remembering back in the day for me, really, that when I was on the opioids, like from the back pain I had at the time, about the fog brain, and I started growing out, but it's like, as I call it, like I put on a hell of a lot of weight, and all the other stuff. But I knew at the time, then that was back in the early mid 90s, but that was on offer. And it wasn't until I started learning self management skills via the pain management program in London.
Yeah.
Back on track. But so in this booklet, it's about concentrating on 5 key self management skills, and I know what it is. I like the group of 5. But have you got 5 tips that you can give people for considering wanting to use swap medication and use self-management? What top tips have you got?
Yeah, so the first tip would be that this isn't something you should do yourself. It really isn't. These medications are, they take a long time to get on them and to get on and increasing up the doses, and you must take time to come off them. So it isn't something that you should try and do by yourself. That's really important. It can take a long time to come off them, and it needs a lot of support. So the first thing that you really must do is make an appointment with some healthcare provider locally that you trust. So it doesn't have to be a GP. You can initially make an appointment with a nurse at your practice, or a first contact practitioner, whoever, if there's somebody you've got a relationship with at your GP practice, that would be the first port of call. And the second thing is then to have a...
Before we go into the second one, can I ask, so they don't have to see a prescriber?
To open up the conversation, you don't have to see a prescriber. To actually formulate the tapering plan, they would have to take it through to a prescriber. But I know these days that it can take, depending on where you're listening to this, and if you're in the UK, it can sometimes take a little bit of time to get in with a GP, and that GP might not know you. But if you want to open up the conversation and start to talk about it, then going to see anybody at the practice is a good start. But the second thing is then to have a bit of a clear idea of what you want to talk to them about before you go in, to sort of think about, have a really clear idea of the way you're taking your tablets, what you're taking, how you think they're making you feel. So if you think it's about side effects, talk about, make a note of how much weight you think you might have gained since you've been on the medications. If you're talking about that you've got brain fog, in short appointments healthcare professionals have with you, they may not have had the time to ask you if you're experiencing those things. So take the time before you go there to think about if there are any side effects you think you're having, or if you often think the tablets aren't actually working, that if your pain levels, if you still feel that your pain levels are 8 or 9 out of 10, and you've been told on many occasions that you're on really strong painkillers and you're doing things, the chances are those painkillers just simply aren't working for you. And we know that is the case for a large proportion of people. So have a plan of what you want to talk about. Be clear that when you do go and see them, that you're not asking for more drugs, or you're not asking for different drugs. That what you want to do is see whether or not you can try and reduce the medications that you're on, and then either ask for some support in terms of, if you're not under your local pain management service, it's a good idea to ask to be referred to your local pain management service to get access to the psychological and physical therapy specialists that form part of the pain teams, and the specialist doctors as well, because depending on what medication combination you're on, your GP may wish to access support from those healthcare professionals and some guidance in reducing. There may be a long wait for that though, and there wouldn't be any reason why your GP couldn't start doing a reduction program with you, working really slowly and helping you access all of the wonderful self-management information that's there on the pain toolkit. The next thing is about it is to try and have a goal. That's one of the key tenets of the pain management service. What would you like to be feeling differently? Do you want to, is it about seeing whether or not you can lose any weight coming off the medication? Is it about seeing whether or not your concentration is better? Are you able to read a book? Are you able to do something else? Look at what your goal might be for reducing, and look at what your goal might be for self-management, looking at those side of the toolkits. And to then just, the final sort of tip really is to take it really, really slowly, and to take it at a speed that you feel comfortable with. So I think that's where it is about trying to find somebody, and pharmacists in your local GP practice can do it. Prescribing nurses can do it, or under the pain team, looking at people who will work with you to work out what the dose is that you can go down on and how quickly you go down on it, and taking it at a speed that works for you. Because some of these medications, to come off them can take a long time, and you can experience significant side effects if you come off them too quickly. So it is really important to do it really slowly, but it is really worthwhile if they aren't actually working for you and you are getting side effects.
I remember back in the day when I went on a pain management program, and what part of the program was the medications we were taking, etc. And I think back then, I'm pretty much of a slow learner, but it did take me some months after coming off the program. But doing the things that they taught me and etc. But it did take me some months, and if I think to actually stop taking, well, there was no need for to take any more pain medication really. And I was so pleased, like, you know, because I mean, I reached that point back in the day myself where I knew whatever, you know, no matter how much I was taking, that just wasn't working, like, you know, and that's why I started looking around for pain self-management skills. So,
yeah, that makes it makes sense. I would say a really interesting thing to know is that from the 20 years that I've worked in pain management services, in the end, I would say at least a third of all patients that we see end up are taking no pain medication at all. And that's not because we've magically been able to get rid of their pain. It's because those medications don't work, don't do anything, and we're giving them horrible side effects. And so they might still have had, they will still have had pain, but the pain medication wasn't actually working for you anyway. So I think the really thing to think about for anybody who's considering coming off is on lots of medication for pain, because that is what we all get given when we go and see healthcare professionals, because we have a desire to try and get rid of the pain if we can. That's normal and understandable. Is really looking at saying, is this actually working for me? Is this actually doing anything?
yeah.
And am I actually getting any side effects from taking this medication, and do those side effects outweigh the benefit?
Well, thanks, Grania. I appreciate that. Listen, I found that really useful and brought back some memories for me. And listen, guys, you know, watching the video that you know, people think that I'm not in pain myself anymore. Like, you know, yeah, I still get pain as I become an older fella now, older guy. I've got other health issues kicking in, like arthritis and prostate cancer and stuff like that. So I get different pain, sorts of pains, etc. But because I learned self-management skills back in the '96 when I won the program, they're all transferable, you know, from my life really. So I'm still using those self-management skills now to manage my pain. So, but the pain isn't managing me anymore. It's I'm managing it, and I'll get on with my life, and I'm still doing, you know, doing more things that I did even before pain came along. But anyway, I hope you found the video useful, and we'll see you again on another video. Thanks so much, Grania.
Cheers.
Ciao.